Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Ankle brachial pressure index. In short, it is known as the ABPI. This is a very important concept. So here it is nothing but the ratio of the. It is nothing but a ratio, and this ratio is of the systolic pressure at the ankle to that of the arm. The systolic pressure of the at the ankle. So at the ankle to that of the arm. So the numerator is the highest pressure in the dorsalis pedis. So the numerator is at the highest pressure. So it is at the high pressure. And this is in the dorsalis pedis. So this is present in the dorsalis pedis. And also the posterior tibial. Also the posterior tibial and the peroneal artery. And also the denominator is the highest brachial systolic pressure. So we saw the numerator. Now when you look at the denominator, it is the highest brachial systolic pressure. Highest brachial systolic pressure. Now let's look at the reading and the findings. So in terms of the ABPI reading of greater than 0.9 to less than 1.4. So in such situation, the interpretation is normal. So greater than 0.9 to 1.4. Then when we look at less than 0.9. So in terms of less than 0.9, there is a diagnostic of occlusive arterial disease. It is diagnostic of the occlusive arterial disease, and this is in patients with symptoms of claudication. So the patients with symptoms of the claudication and or the other signs so other signs of the ischemia. Next we look at the 0.5 to 0.9. So here there is arterial obstruction often associated with the claudication. So there's arterial obstruction and this is associated with the claudication. Now when you're looking at less than 0.4, so if it is less than 0.4, there is a critical limb ischemia. So critical limb ischemia is a multi-level obstruction. It is a multi-level obstruction, and that is any combination of iliac femoral. So any combination of the iliac femoral or the tibial vessels disease, and it may be associated with a non-healing ulcers. So it is associated with non-healing ulcerations, as well as there is a ischemic rest pain and the pedal gangrene. There is ischemic rest pain as well as the pedal gangrene. Now when you're looking at greater than 1.4, so greater than 1.4, it signifies a poor compressibility of the arteries. So it signifies poor compressibility. So it suggests of a poor compressibility, and this is of the arteries. So poor compressibility of the arteries, and it is mostly due to the calcification. So this is mostly due to the calcification, and because of the increased age. This is because of the increased age as well as the diabetes. So in terms of there is a fall of the resting ABPI. So there is a fall in terms of the resting ABPI. So in such case, if it is greater than 20%. So if it is greater than 20% after the exercise. So greater than 20% after the exercise. So this is indicative of the arterial disease. To learn and grow daily like this, please do subscribe.